All right, welcome everyone to tonight's webinar. It is the first Wednesday of the month as usual, and I am your host, Morgan Tiroff. I am a senior programs manager here at Can-Do MS, and I am so thrilled to be with you guys tonight to talk about how to be your best sexual self with MS. So without further ado, I'm going to introduce our lovely speakers for this evening. First, we have Roz, our psychologist, with us this evening, joining us from West Bath, Maine. And then we also have Shannon Schneider, who this is her first webinar, so give her a warm welcome. She is our occupational therapist speaking with us this evening. So thank you both for being here, and I will turn it over to the both of you to get us started.
Awesome. Thank you so much, Morgan. Like she said, thank you all so much for being here. We are hopeful that by the end of this webinar, you will all be able to kind of learn the interrelationship between communication, intimacy, and sexuality, become familiar with the ways that MS can impact sexual feelings and functioning, learn about the treatments available for sexual challenges, and get tips for starting difficult conversations with partners and healthcare providers.
Thanks, Shannon. It's good to be here with all of you. And I want to start by talking about the role of sexuality in our lives, because I think it's a lot more complicated than most of us think about, particularly when we're in our teens or 20s or 30s and life seems simpler. But I think it's important to think about our sexuality as a part of who we are, a core part of our being. It's a way of enjoying our physical selves, either alone or with someone else. It's a way that people express love, connection, closeness, or a variety of other feelings. It's a way to just have fun, individually or with somebody else. And it's a path to relaxation, to a feeling of calm, and just being in a good place. It is a wonderful but non-essential component of intimacy. How each person decides to incorporate sexuality into their intimate relationships and their intimate life is a totally personal decision, and there's no right or wrong way to do it, and there are no choices that are right or wrong. You do what feels right in your own life and in your own being. If and when our ability to express ourselves sexually changes, whether it's due to normal aging, disability of one kind or another, the intimate connection can go a variety of ways. It can lessen, it can stay the same, or it can even grow. Sometimes when people are forced to be creative and try new things, they discover that their sense of connection and intimacy actually deepens. So we want you to leave here tonight knowing that the choice is yours to make. Okay. So, yes, your MS self, the self that has now got MS, and your sexual self, while they sometimes might seem like they're at war, they can actually cooperate. They can work together to overcome challenges. So the first step, which I hope we're going to fulfill tonight, is to help you understand the facts about MS and the sexual response. It's really important to know the role that MS is playing so it doesn't get confused with what else might be going on in my relationship or in my feelings. You need to understand the role that this neurologic disease plays. You need to take time to get to know your own body, how it's the same, how it's changing. And if you have a partner, you need to be able to share what you've learned. That's very important communication, because your partner, like every other aspect of MS, your partner cannot read your mind. You have to communicate and teach what you've learned. You need to speak up for yourself with your healthcare team. At large MS centers, they are very likely to ask you routinely if there are any changes or problems you've noticed in this area of your life. But for many people, seeing practitioners in the community, this subject may never come up. And even if you try to bring it up, they may not be comfortable answering your questions or talking about it. So if they aren't interested in this important aspect of your life, it's time to go looking for another provider. Step 5 is to be willing to do things differently. This is just like any other aspect of MS, where your ability to do things that are important to you is changed or altered in some way. You need to be open to trying new things and giving yourself grace. Instead of focusing on all the things that you can't do the same way, it's looking for ways that you can do them. And by all means, keep a hold on your sense of humor. It helps.
Great. So these virtual webinars are amazing, but it's hard for Roz and I to know who all is out there. So we have some polling questions for everybody. So we just want to get a sense of your current sexual needs and knowledge base. So we're going to start with, have your healthcare providers ever asked about sexuality and intimacy? Okay. So majority say no. Most people have not been asked by their healthcare providers about sexuality and intimacy. Okay.
But the good news is only 1% said they would faint if they were asked. So
That's true.
A step in the right direction.
Woohoo! Which aspect of your sexuality or sexual feelings has changed the most? Okay, neck and neck, interest and orgasm, and comfort is up there too. Okay. Interest. Good. Thank you. All right. Where do you get information or support about these changes? Nobody. Okay. So nobody and internet are the top two there. All right. Well, I'm glad you guys are all here then, so we can answer a lot of these questions. This is good that you. All right. What forms of intimacy do you find satisfying? Okay. Touching and cuddling, neck and neck, followed by sexual activity and talking.
Yes, it helps us a lot. And thank you for being so open and sharing with us, because that helps us help you. So let me start by talking about what we know about the ways that MS can affect sexual function. Many people don't know this, so they're concerned when things change, or they wonder what's going on, or they just are confused. So here's what we know. We know that these changes are a very common symptom of MS. The majority of people living with MS experience one change or another. The important thing to keep in mind here is that if you do surveys in the general population, sexual difficulties are very common as well. So you're certainly not alone. You're in good company with most of the people in the world. They just don't talk about it. The changes related to MS fall into 3 categories that have been given these very sexy names of primary, secondary, and tertiary. But what's important about them is that the primary changes are directly related to damage in the central nervous system. So just like any other symptom of MS, when the nerves are damaged, things change. And we're going to go into details about these in a minute, but the primary ones are directly disease related. Secondary changes are related to other symptoms of MS, such as pain or fatigue or spasticity or bladder problems, right? It should also say here, or medications that people are taking. So it's not directly caused by the disease, but by these other factors. And the tertiary issues are actually the most complicated, because they're the ones that have to do with our feelings and our attitudes and our cultural values about age, sexuality, disability, and beauty, because those attitudes really impact the way we feel about this important aspect of our lives. If that weren't complicated enough, we know that life can get in the way as well. So sexual function is also impacted by aging, by menopause, by other health conditions that we have in addition to MS, as well as by smoking, alcohol, the range of medications that people take, and diet. So there's just a lot of ways that sexual feelings and function are affected, so we need to be keeping those in mind. So now I want to go into a little more detail about these changes. This is a complicated slide, but I did it this way because if you print out the slides, then you'll have this as a sort of a quick reference sheet. So if we look at those primary changes, the ones caused directly by the neurologic damage that happens, you see that women have reduced interest. People have described it to me as though a light switch is turned off. They just don't feel that nice, oomphy feeling that they used to feel. That happens more in women than it does in men. But both men and women experience changes in sensation, how their skin feels, how their body feels to the touch. Women have reduced vaginal lubrication, and that vaginal lubrication is the equivalent of what happens when a man gets an erection, right? That's arousal that happens in the genital region, and both men and women experience that change in arousal. Both men and women experience changes in in orgasm or the ability to reach orgasm. This means that the orgasm may not happen or it may feel different than it felt before, sorry. The secondary changes are like the ones I mentioned. You know, if you're so tired that you can't think straight, then sex may not be on top of mind. Or if you're in pain, or your body is stiff, or you're having bladder or bowel changes that make you worry about having an accident. When people are depressed, they're not as interested in having sex. And even cognitive changes can interfere because in order to stay aroused during sexual activity, you need to be able to focus. And when you're distracted by other things in the environment or your own thoughts or anything else that's going on, you may lose that focus and therefore lose the arousal. Okay? There are also medications that make a difference. So the bladder medications that are used when people have an overactive bladder dry up more than just the bladder. So they can contribute to vaginal dryness and other discomfort. Antidepressants are well known for potentially interfering with orgasm. And so it's really important if you're taking an antidepressant to work with your provider to figure out ones that you can take or ones you can use in combination that might help with that issue. Blood pressure medications are also known to cause difficulties, and there are others. So again, you need to talk to your healthcare team and your pharmacist to know which of the medications might be interfering. And then those tertiary changes I talked about. And when you think about these attitudes and these feelings, they're really kind of hardcore feelings that are hard to change or hard to modify in ways that are more positive. I don't like my body anymore, so why would somebody else? And again, this can be because of aging or it can be because of disability, but that feeling of not liking yourself gets in the way. I'm turned off by illness or disability. It's only within the last couple of years that we've seen any billboards with photos of people with disabilities or TV programs with heroes and heroines who are disabled. It's really been something that the cultural message has been, this is just not sexy. You may have role changes within your relationship. So I've heard partners say it's hard to feel sexual as a disabled person or as a support partner. The MS kind of gets in the way like a third wheel. And I've certainly heard support partners say, I'm concerned about hurting or fatiguing my partner or making a request when they've just got so much to deal with it. Sex is not very appealing to them. And of course, it's the old way or no way. which may be the biggest bugaboo of all. If I can't do something the way I used to do it, or I did it when I was 20 or 30 or 40, why bother? So we're hoping tonight that we're going to help you change some of those feelings and attitudes that might be getting in your way. So I'm going to start with some general tips, and then Shannon's going to fill you in on some of the details. But I think when you're trying to revive your sexual self or bring it back to life after maybe some time off, you really want to do some detective work. You want to ask yourself honestly and openly, what has changed? Is it your interest? Does it feel different? Do the sensations that used to feel good now feel bad or painful, or you just don't feel anything at all because everything's numb? And you want to think about what might be getting in your way. And that's where that list of primary, secondary, and tertiary issues is really helpful, because you can pinpoint first in your own mind, and then if you have a partner, with your partner, what's getting in the way and what could you guys do together that would overcome the obstacles that you're having. You want to consult your MS provider and your primary care physician and ask for a referral if necessary. I would talk to anybody on your healthcare team that you feel comfortable talking to. That's the most important thing. And if they're not comfortable talking, they should be able to refer you to somebody who is comfortable and can answer your questions. This body mapping exercise refers to the question that you saw in the poll about, have you spent time getting to know how your body feels or how it's changed since MS? So the body mapping exercise involves spending time alone, without any clothes on, just getting to know your body from the tip of your toes to the top of your head. Are there parts that feel good, that don't feel good because they have uncomfortable pins and needle sensation or pain associated with them? And why it's important to do this is that, believe it or not, people discover parts on their body that they just hadn't paid any attention to before because they didn't need to or they didn't want to. But there are lots of parts of your body that can provide pleasure and comfortable, enjoyable sensations. Once you've done that, then you do it with your partner, not for the purpose of having sex, but for the purpose of teaching what feels good, what kind of touch you like, a firm touch, a gentle touch, a scratchy touch, where it feels good, because it may be totally different than it was before. And if you don't let your partner know, there's no way that he or she can just guess. You need to be ready to be flexible, creative, and adventurous. I know it's scary sometimes, but being willing to just try new things, and if it works out well and you have fun, that's great. And if it doesn't work so well, you give yourself grace and try something else. And these tips absolutely apply to normal aging as well as MS. This is what older couples are going through all the time. Shannon, can you help us figure out who can help with all of this?
Yes, of course. So as you work on reviving your sexual self, you might be wondering which team members can help with what. And, you know, we love to use all these little abbreviations like PCP and PT and OT and LMNOP, and it just can be a little bit confusing to know where to go for what. So neurologist and primary care provider, they can really help get you some basic information, give you referrals and some of the medical treatments that Roz has mentioned. Urologist can help with bladder management as well as male sexual problems. Physical therapists can help provide you with some exercises and stretching, and also assist with, helping you learn some different positionings that's comfortable for your body. And then there's also a specialization in physical therapy called pelvic floor physical therapists, and I'll touch a little bit more on that later about what all they can help with. Occupational therapists can help with energy conservation, give you tips and tricks, and also help with some of that positioning needs. Mental health professionals can help work with you about your different feelings and attitudes, relationship issues, communication strategies with your partner. And speech and language pathologists can also help with some of that communication and help address if there are any cognitive concerns, as Roz mentioned, trouble with paying attention, getting distracted, concentration, all of that. And then pharmacists can help give you information about side effects and medication interactions that you're taking, that's individualized to you. So as Roz mentioned, really there's no wrong place to start. The most helpful provider is the person that you feel most comfortable with. And if you do bring it up and they don't feel comfortable, then they should be able to at least, refer you to somebody who is. So occupational therapists are healthcare professionals that are skilled at analyzing and adapting daily activities to improve the overall satisfaction and independence in activities of daily living. So we call those ADLs. And sexuality and intimacy, believe it or not, is an activity of daily living. You might be rolling your eyes and saying, no way, not daily for me. We all have different needs. So our job is to help remind you that our access to intimacy, sexual participation, and sexual identity are part of a person's overall holistic health. So whether it's sex or just intimate actions, it's important to cover that because that's a big part of our identity. And our role is to help break down barriers to sexual challenges. So if you have decreased mobility or your sensation is different, maybe you have a lot of pain or get overheated, fatigue or bowel and bladder issues, our job is to help kind of give you workarounds for how to deal with some of those symptoms and still be able to engage in sexuality and intimacy. So spontaneity is fun, but the first few times when you're trying to get a little more comfortable with it, having a little more planning is helpful to ensure a positive experience. For instance, if you are somebody that has a significant amount of pain or increased muscle spasticity, you may want to try to plan those first few times around when your medications are most effective. That way you're able to enjoy the experience and kind of get a good feel for what's going on. As Roz mentioned too, use your communication skills with your partner. Nobody can read your mind. So if, saying statements like it feels good when you do X, Y, and Z, or I like it when you do this, or maybe I don't like this anymore, your support partner might be confused and just not wanting to overwhelm you, not wanting to hurt you. So if you don't speak up, they just won't have any clue what's going on with you. And the body mapping exercise, think outside of the box. Your changes in sensation and mobility changes and pain and spasticity can just lead to different sensations in different areas of your body. So when you are experimenting on yourself, you just want to have an open mind and try different things to see what is feeling good to you at this moment in time. And of course, that may change on any given day, but at least gives you an idea of where to start. So as you kind of get more comfortable with your body and learn what feels good, then communicate that with your partner, and then eventually, some of that spontaneity can return. So you want to try to engage all of your senses. Explore your erogenous zones. You have a lot more than you think. So your, top of your head, your cheeks, ears, neck, arms, just trying different areas and seeing which ones feel good to you and which ones maybe don't. Especially if you do have changes in sensation in your genital region, then definitely really try to explore all those different areas of your body and find areas where it does feel good to you. You can also consider light touch versus deep sensation. Maybe previously you used to like light touch, and now the deeper sensation maybe feels a little bit better to you. You can also consider oral, manual, and mechanical stimulation. And then don't forget about smell and taste. Those senses can play a huge role in sexuality and intimacy as well. So the more senses that you can involve, probably the more fun that you will have. And then everybody knows their own body, but if bowel and bladder accidents are something that you're concerned about, sometimes we recommend that people go ahead and manage their bowel and bladder before they have sex. So if it's possible, going to the bathroom with bladder, I have on here double voiding. And what that means is you go to the bathroom, and then if you're sitting down to go to the bathroom, you stand up, sit back down, and empty again. And that just helps get a little bit of extra urine out, which can help prevent an accident when you're actually having sex. And then for females, typically doctors do recommend that you manage your bladder again when you're done having sex to prevent any urinary tract infections. And that's another thing, like you have to get to know your body and how your body reacts. Some people don't need to worry about that, others do. So it's just kind of a little bit of that planning ahead of time for the first few times is helpful, but it won't always have to be that way. Other things to consider: energy conservation. So typically most people have a lot more energy in the morning time, and then kind of fade out late in the afternoon and even worse in the evening. So if that's something that you experience, you might want to consider trying to engage in sex and intimacy in the morning when you have a little bit more energy, so that you can enjoy it as much as possible. You can get, a 2-for-1 special. You can do some yoga, stretching, and positioning, check some of those stretches off of your to-do list while you're kind of trying different positions with your partner. Once again, just another reason to talk with your partner and figure out, show them different things that you can do and what feels good to you. And then there's also actually a lot of adaptive equipment out there. There's straps and harnesses, which can be really helpful if you have decreased hand function. It can just kind of give you a better hold on your partner. You can also use them for your legs. You'll see kind of on some of the pictures I have on here, but just you can use them to really help support your body if you have weakness in any area of your body. Pillows are always helpful too, and just trying to kind of lift your hips up or give yourself a little more support if you have pain in your legs, using those pillows to provide a little more cushion so that you're not in pain. And then cooling devices. There's so much out there now. There's bra coolers, and there's personal neck fans and neck coolers, wrist coolers. So figuring out if you do get overheated pretty easily, then don't wait until you're already overheated to use some of these strategies. Try to go ahead and put a cooling wrap around your neck, or turn the temperature down in the room. Taking a few sips of cold water can also help. But once again, try to kind of do those preventatively and proactively rather than reactively. If you do end up using any adaptive equipment and you have limited hand function, most of those devices can be adapted. by adding a little cuff to it, or building, if there's a button, and an occupational therapist can kind of build up the button so that you can access it a little bit easier. Those are all options. So really everything's fair game. Sex toys, vibrators, sexy videos, whatever it takes to kind of lighten the mood and just get you back to the level of engagement that you're hoping for. And I mentioned it earlier when we were talking about physical therapists, but there is a specialization called pelvic floor therapists, and they're amazing. It's for males and females, and they specialize in understanding the musculature in your pelvic floor, which is hugely responsible for your sexual function. So that therapist would assess sensation and muscle function of the pelvic floor muscles, and then help. Some people have weakness down there. Other people, their muscles are actually too tight, which can contribute to some pain. So they can really help give you some exercises and techniques to help reduce pain if you do have pain in your pelvic region. And then, as always, make it fun. Laugh and use humor to lighten the mood. And regroup, after you have sex, if something goes funky, talk with each other about it and laugh it off, but also talk about maybe what you could try next time to make it go smoother. And the more you can talk about it, the more and more comfortable you'll get. So this is just a combination of a few different devices that are out there. The one in the top left, it's a little hard to see. I apologize about that, but that is called the Intimate Rider. So the gentleman is sitting on it. It looks like a wheelchair, but it's not. It's a small little seat with a backrest, and it takes just a very little bit of movement from him, and it'll start rocking back and forth, and then it just goes with momentum. So if you have lower body weakness or trunk weakness, or you just get tired quickly, something like this could be really helpful, because you're not really having to put as much effort in, but you're still getting that same motion with less work. And then the Liberator wedge is the red wedge that you see in several pictures here. So depending on how you place it, it can be used in a variety of ways to help sit you up in bed, to help lift your hips up, to help support you on your stomach, or to support you on your back, but lift your hips up a little bit so that your partner is able to access as easily as possible. And then the strap there is used, it's a little bit hard to see too, but it's in the picture on the bottom right. It's being used around her legs to help keep her legs wrapped around him, so that they're not, it's one less hand that has to be back there holding the legs back. Also, these types of straps are really helpful if you do have muscle spasticity. It can kind of help keep your legs in the right position. And then also, if you have a lift, a mechanical lift, a Hoyer, you can actually use that to help hoist yourself up so that you're able to be in good alignment. So really, any and all equipment, if you can think about it, if you can figure out how to make it work for you, there's nothing that's off the table.
And a PT or an OT could help with that. I mean, you can bring it up, right, Shannon? And
Yep.
They can coach you on how to use these comfortably and safely.
Yes. Yep. Exactly.
Okay. Great.
Yeah. So all of the equipment that you just saw on the previous slide is listed here for reference. And then there's also some other good resources on there to just learn a little bit more. The sexualityandisability.org has a ton of great resources about how to all the topics that we just went over, that covers that. And then we also have found some information on the clitoral vacuum suction device. So that's the erostherapy.com. And that is something that can help if you are having trouble reaching orgasm or have decreased sensation down there. That there's been some studies out involving that helps increase sensation and increase orgasm.
And those studies were done in women with MS, so it's really worth checking this out because they had some very positive results with this vacuum suction device.
Yes, definitely. And then there's a video from Shepherd Center that is kind of gives you some different ideas for different types of positioning. So it's an educational video. It's designed for women with spinal cord injury, but it can be utilized for anyone with mobility impairments. So that can kind of give you different ideas for positioning and what would work for you and your partner.
So
And then, yeah, go ahead.
as you heard from Morgan, there are 3 documents that you can see in the handouts on your toolbar. And those are available for you to download. So there's this presentation deck, there's an intimacy and sexuality brochure from the National MS Society, and another manual for persons with disabilities. So please download them and make good use.
Thanks so much, Roz and Shannon, for all of that really wonderful information. As I had mentioned before, we will take the last 17 minutes or so to move into question and answer. So I'm going to stop sharing my screen so we can just have a little chit chat about some of the things that people have been wondering. The first question that we have for today is about how to recover after not being sexually active for more than 10 years and feeling like your body isn't working like it once used to. How would you suggest someone get started once they've felt like they've been kind of out of the game for a little bit?
Well, I'll start, and then I'm sure Shannon will add, but I think this is a situation when the body mapping exercise is a really good step 1. Your body's still there, it's still responsive, you just have to get to know it again and get comfortable with it and find out what feels good for you so that you can share that with a partner if you choose to do so. But you got to know your own body first. And if you discover that you need more stimulation than you used to, which is very common in MS because sensation can be reduced, that's when things like experimenting with a vibrator or experimenting with that clitoral device if you're a woman, or experimenting with manual or oral sex, because that is more direct stimulation and your body may need that in order to respond the way it used to.
Yeah, and I would just chime in too, reminding yourself, like we mentioned, sex is one part of intimacy and doesn't have to be the end all be all. So starting slow, starting at your own pace. Maybe it's just the cuddling for now, and kind of working your way up to figuring out where your body is right now.
Great, thank you both. Our next question is kind of in that same vein of kind of figuring out what your body feels like. Someone asked, how do you find out if the nerves have been affected, like your sexual nerves, by MS? Is there a way to find out, or is it just by trial and error?
You'll know.
I would say by trial and error.
You'll know. It just, your body won't respond the way it did in the past. Now, again, remember, aging, alcohol, smoking, other health conditions can all play a role, but the simple answer is that you're used to your body being able to respond a certain way, and it won't if nerve damage gets in the way.
And that's when it would be good to bring it up to whatever healthcare provider you're comfortable with. If you're, confused or not really knowing what's going on with your body, then they should be able to help answer some of those questions and at least guide you in the right direction.
Thank you. So our next question is about communicating and working with their partner. So what are some specific and non-official ways to communicate messages regarding pleasure, mood, or lack of desire? I know we touched on a couple of these, but if you're trying to bring it up in a casual sense, do you have any suggestions on how to approach the subject?
Every couple is different. Every couple uses different vocabulary or no vocabulary, they just point. But let me just say that getting comfortable talking is a form of intimacy. So the more that you can share, the more information you can give, you're building a bridge, right? And that is an intimate act. You need to teach your partner what feels good. If the words don't come easily to you, the booklets that we've given you to download will help you with the vocabulary to use. You can read it together so you don't have to make it up yourself. The most important thing I think to remember is that silence or just shying away from this altogether is very easily misunderstood. So in your mind, it may be, well, it's a mess and it's complicated and it doesn't feel as good as it did and I don't know what, but to your partner, it's, oh, she doesn't find me attractive anymore, or he doesn't find me attractive anymore. It's very easy to jump to negative conclusions. So the more that you can share in whatever way is comfortable for you, the more you bridge that gap and avoid misunderstanding.
Yeah, and hopefully, like Roz said, you can utilize the resources that we've added on here to get as a jumping off point, you know, whether your style is serious or funny or not many words, you know, hopefully there's a lot of options on there to help you kind of get started with this.
So moving back to kind of more of like the sexual function, we have some questions coming through about solutions for anorgasmia or ED, when you really cannot reach orgasm or you might have erectile dysfunctions. Do you guys have any suggestions for people who are dealing with either of those problems?
You want to go first or do you want me to?
Oh, sure. That's another good question for one of your physicians as well, because for erectile dysfunction, there are some, you know, oral medications that can work, but there are also vacuum type pumps that can help maintain an erection for males. And then we mentioned the clitoral stimulation device for females, which kind of helps get extra blood flow to those areas, which can help kind of regain some of that sensation down there.
Also, I think if it's medication related, you can talk with the doctor about medication scheduling that might help with anorgasmia. Also, you know, anybody who's watched any sporting event in the last 15 years, including my grandchildren, can tell you about all the medications for erectile dysfunction. They, according to the urologists I've spoken to, they do work very well, but they don't work for everyone with MS. So it's important to try them first, because they're obviously the easiest ways to deal with erectile dysfunction. But if they don't work, it's important to know there's a long history, as Shannon mentioned, of tools and strategies that men have used over the ages to help with erectile dysfunction, because of course men were doing all the research in this area, so they came up with 500 strategies for erectile dysfunction while they left women in the dust. But anyway, the urologist is really your go-to person for male sexual dysfunction, and they will show you a wide array of options that you can try. The most important thing, though, for me is to remember that the stepladder approach to sex isn't the only one. What we were taught growing up is that you have foreplay, more or less, depending on who you are, and you climb the stepladder toward orgasm, and that's the be-all and the end-all. But one of those things about thinking creatively and being open to new ways of doing things is that the stepladder approach isn't for everybody, whether it's due to disability or aging. That movie romance, everybody has an orgasm at the same time and then they lie back and sleep or smoke a cigarette, isn't necessarily the only way to approach sex. You don't have to be doing it the same the same things at the same time in order to feel close and intimate. You don't have to be doing the same things at the same time in order to give and receive pleasure. So whatever feels good, whatever works is okay. And if you find that you can't reach an orgasm anymore for whatever reason, that body mapping exercise can really help you identify places on your body that feel exquisitely wonderful. I know you don't believe it because you haven't had to try them, but they're there for you to explore and to share with your partner.
So you'd mentioned a couple of medications that you might be able to talk with your healthcare provider about, and there have been quite a few questions on if there were any medications that you can use, but one specifically is if there's any libido pills that might help with sex drive.
So for women, there have been a few that have been approved by the FDA, but the one I know of right off the top of my head is a medication called Advia. And it was approved specifically to treat or to increase arousal in women. I think it's ADDYI or ADYI. And women have found that it helps. Some gynecologists also prescribe some testosterone for men and women that can help with arousal. And as I said, for men, the thing to know about the treatments for male arousal, two things. The pills that are advertised everywhere, they work by allowing an erection to occur when you are stimulated, physically stimulated, mentally stimulated. They allow that blood flow to happen that creates an erection. If that doesn't work, there have been injectable medications around for decades. I mean, like 60, 70 years, and people say, oh my God, I could never inject myself. But what I have been told by many men is that the injections, it's a very small needle in the base of the penis, which is an area that is not very sensitive to pain. And what men like about this is that it's more predictable than the pills. When they inject papaverin, it creates the erection. So they don't have to worry about whether it's going to happen or not. It just happens. And then it works just like the erection that you had before. So it is really worth talking about those options with a urologist.
All right, so we have time for maybe one more question. And I'm going to try to combine a couple because I think that there's been kind of a theme here. So people are expressing concern about what to do when they're having pain during sex. Some of that includes pins and needles. Others just are saying nerve pain, including their sexual areas. What can I do where I want to have pleasure but not react like I'm so uncomfortable that my partner doesn't want to continue?
I think this is an important conversation to have with the neurologist, because the neurologist is the person who prescribes medication for neurogenic pain of any type. So they would be able to let you know if there are medications that might help with the pin needles or any other neural pain that is triggered by the sexual activity. I would also say that you talk to a physical therapist, including a pelvic floor physical therapist perhaps, about whether there are ways to alter the positioning or the movement that would decrease the pain. Shannon, do you agree with that?
Yes. Yeah. Even just a slight tilt of your pelvis can, like with a pillow or something, sometimes can make a world of difference with pain. So small little changes to your positioning. I'm not saying it's going to make the pain go away totally, but it'll make it more tolerable so that you can enjoy it more. And then, yeah, the pelvic floor therapists are amazing. And perhaps some of the muscles in your pelvic floor are tight, and that can actually be like a trigger point that's causing worse pain. So there's manual therapy that can be done to release some of those. So definitely PT is a really helpful route to consider if you are having a good amount of pain.
And spasticity, I believe, can happen anywhere in your body. Right?
Yep.
Not just in your foot or leg or arm.
Yeah, so it can happen in those muscles too.
Yeah, so describing that to the neurologist and the PT, although it may be hard for you to bring this up and talk about it, that really is the best way to get the help you need to give as detailed a description of what's happening as you possibly will help them cut to the chase and recommend what will be most helpful for you.
So thank you so much to everyone who joined us this evening, and we hope to see you all at a program soon.
Bye.
Everybody, thanks for joining.